Good afternoon. I'm Noreen Yazejian, and I'm a scientist at the Frank Porter Graham Child Development Institute, FPG, at the University of North Carolina at Chapel Hill. From research conducted at FPG and elsewhere, we know that for optimal development, children need a healthy foundation that includes stable relationships with responsive and nurturing early educators who scaffold learning, adequate nutrition beginning in the prenatal period, and safe and supportive physical environments. When these foundational supports are in place, children's brains and bodies are more likely to develop in healthy ways that lead to future success. The birth to age 8 period has been shown to be critical in terms of setting children on academic trajectories that remain stable from early elementary school on. Children who are vulnerable, for example, those who are less likely to receive these foundational supports because of risk factors such as poverty or historical disenfranchisement, should be prioritized in plans to improve children's seamless movement through the birth to age 8 continuum. Seminal research, including the Abecedarian study conducted at FPG, provides a blueprint and rationale for providing high-quality early education programming to reduce achievement gaps and adverse life outcomes associated with risk factors. To provide a healthy foundation and ensure that children move seamlessly through the birth to 8 continuum, 3 supports are critical. First, at a proximal level, children need high-quality educational experiences with responsive and nurturing educators. Whether these educators are center-based teachers, home-based providers, home visitors, or family friend and neighbor caregivers, they can do 2 things. 1, promote language skills, and 2, use data to individualize and improve instruction. Language skills are promoted through frequent conversations involving variety in vocabulary, multiple conversational turns, and diverse types of talk, including decontextualized talk. The importance of early language development cannot be overemphasized. Recent work suggests that language skills at school entry are the single strongest predictor of later academic success. High-quality educators also use data to individualize instruction and for continuous quality improvement. For individualization, evidence suggests that progress monitoring and tiered instructional models, such as FPG's recognition and response, targeted reading intervention, and others, can help teachers provide the scaffolding children need to achieve. Regarding continuous improvement, quality is a journey, not a destination. As the field gains new tools for measuring quality and evidence about what children need to succeed, educators must commit to continually evaluating and modifying their practices. Second, at a more distal level and in a parallel fashion, the birth to 8 educators supporting children need healthy foundations that include professional development providers who scaffold their learning as educators. Research suggests that professional development is most effective when it is focused on specific content and linked to classroom curriculum. Models of professional development that include coaches, consultants, TA providers, or mentors are currently widespread. However, as we heard this morning, little is known about the credentials, preparation, and skills these individuals bring to their work, nor about the degree to which they implement their particular models of professional development with fidelity. Much more research is needed to determine how to provide professional development to support early educators' instructional support skills, particularly with regard to fostering more complex skills development, such as children's language. Finally, at a more macro level, there is a need for greater alignment among and within the various systems that serve children and families. Children and families, particularly those with multiple risks, need the support of a coordinated system of early learning, parent engagement, social emotional development, and health and nutrition. Because a birth to age 8 system of care does not exist in our country, it is incumbent upon the multiple systems, for example, early care and education, child welfare, health, early intervention, to improve their capacities to share information, coordinate activities, and engage in collective action to ensure that children's experiences are more seamless. As we heard this morning, quality rating and improvement systems represent an approach for aligning quality and professional development standards across early education sectors, and evaluations of these efforts should guide future policy. Vertical alignment across the birth to age 8 continuum in data systems, curricula, and professional development has been shown to support children's development and learning. For example, models of programming birth to 5, such as EduCare, or pre-K to 3 initiatives, such as First School, show promise in improving achievement. However, much more system alignment and coordination is needed across sectors and ages, as well as research to understand alignment processes and associations with children's development and seamless movement. Thank you.
Please join me in thanking all of our speakers. We're going to take a break, which will give you the opportunity to ask more questions if you'd like to, and we'll reconvene here for a discussion of dissemination.